Migraine has affected literally every aspect of my life, starting from early childhood with excruciating attacks through college, employment, marriage, parenting, and of course my social life. I don't think there's any aspect of my life that has not been impacted by this disease.
My migraines have definitely become chronic over the years. When I was first diagnosed with migraine as a child, this was back in the 70s, there really were no treatments back then. In my early 20s, my migraines became chronic. As I got older in my 30s, we began to see preventative migraine treatments come out onto the market. I think it's very, very important to take preventive treatment for migraine, whether you have chronic migraine or episodic migraine. There is always the risk of becoming chronic if your migraines are not treated appropriately. I've tried many preventive treatment options over the years with varying degrees of success. I'm on a anti-CGRP medication right now that is making a huge difference in my life. The alternative treatment is seeing a massage therapist that has a background with migraine patients. I see her once a week. I think the biggest obstacles to finding effective migraine treatment, I would say number one would probably be cost. If you don't have robust health insurance, it's going to be an issue. If you do have health insurance, there are many pharmaceutical companies out there that have patient assistance programs. Those can be absolute lifesavers, but not everybody out there has that. Also, access to a good headache specialist. That can be a big problem for many patients. I believe that if I had been in a position to take a preventative treatment in my teens, my early 20s, my outcome may have been quite different than it was.
What it's like living with migraine for me is it's like rolling the dice. Sometimes I might go to an event and end up with a migraine, or I might wake up in the middle of the night with a migraine, or it might not. My migraine has gone from episodic migraine to chronic migraine. It started about 6 years ago. Over the last year or so, it has started to go back to episodic, thankfully, but it has chronified from injury or other outside events that I'm not exactly sure of. My journey trying to find preventive treatment that works for migraine has been kind of all over the place. I've gone through different trial and error situations with different medications, different homeopathic treatments, just all kinds of different things to try to find what works best for me. So it's been a little frustrating over the years. Different medications that I have actually had success with, a diuretic and a blood pressure medication combination has helped to reduce my severity and frequency, as well as paying attention to proper sleep, diet, exercise, just an all-encompassing variety of things that have worked from my personal experience. I think some of the biggest obstacles in finding preventive treatment for migraine is financial situations with insurance and not having the money to cover a copay or the money to cover out-of-pocket expenses, because a lot of times insurance doesn't want to cover some of the new treatments that are out there because they're too new, they're expensive. In my personal experience, it took several years to even get insurance to cover preventative migraine treatment that was new on the market. To somebody who is having increasing migraine attacks, I would recommend to them that they journal everything from your diet to your sleep patterns and bring that to your doctor and talk to them about preventative migraine treatment.
So over the years, my migraines have chronified. I was doing really good for a period of time. I started off episodic as a kid. Recently, the migraines increased in frequency. So I went from high frequency, episodic, to chronic, and now I'm slowly drifting back into episodic. I think that preventative treatment is essential for migraine because it gives you your control back. My journey with preventatives has been quite complicated. I started off on anti-seizure meds. Of course, it had all these side effects, weight loss, nausea, and then I eventually drifted to antidepressants and then to calcium channel blockers. Eventually, I tried the CGRP meds, and that's when the game changed for me. I think that people do not want to take preventative treatment for migraine because of fear of trying something else because everything else has failed. I think also some people don't know enough about preventative treatment, or the information that they do know is about the side effects instead of having really good information about the effectiveness of those treatments.
It wasn't until 1989 that I first saw a headache specialist and started on my preventive treatment journey. And quite honestly, it's not been an easy journey. 3 times since then, I found a medication that's been both effective and tolerable for me to take. But each time it eventually stopped working or the side effects became too concerning. The most recent time was the most discouraging when the medication was only effective for about 6 months and the migraine attacks came back with a vengeance. But I refused to give up hope and I'm constantly looking for new options. I think that many people with migraine don't want to be on preventive treatment, and there are multiple reasons for that. Partly a lack of awareness of how serious migraine can be and of the risk of chronification. There is still the attitude that it's just a headache. There is a fear, often justified as side effects. There is a cost barrier. There are issues of insurance. Then because of the lack of education or mandatory education in medical school about migraine and the lack of certified headache specialists, most doctors do not know how best to manage this disease. And that can be really challenging just to find a doctor who understands migraine. If I could say 1 or 2 things to someone who is newly diagnosed with migraine or someone who is getting more frequent migraine attacks, it would be that I understand the hesitation to look at preventive options. But migraine is a complex neurological disease that can get worse. It can chronify. And the sooner you can find effective and tolerable treatment or combination of treatments, the better it's going to be for you in the long run. It can make a huge difference to connect with others who live with this disease so that you can get support and current information about treatment options you can then talk about with your doctor.